Okay, welcome back. In this video, we will continue our video series on medical terminology. In this video, we'll go over chapter number 5, the Integumentary system. Alright, the learning objectives for this chapter: define the word parts used to create medical terms of the integumentary system, break down and define common medical terms used for symptoms and diseases, disorders, procedures, treatments, and devices associated with the integumentary system, build medical terms from the word parts associated with the integumentary system, and lastly, pronounce and spell common medical terms associated with the integumentary system. First, let's start off with some basic word parts that you'll see commonly in this chapter. The first one, adeno, or adene, combining vowel O for adeno, as a reference to gland. Auto is a reference to self. Think of the term automatically. You're doing it on its own. Cutaneo is a reference to skin. So anything that's cutaneous is a reference to the skin. Cyan or cyano is a reference to a bluish color. The root word cyan is actually a shade of the color blue. So it's a good indicator that someone is not receiving enough oxygen, so they become cyanotic, so they are turning blue. And the last one on here, dermo or dermato, is also a reference to skin. Folliculo is a reference to a follicle, such as what you'll find with a strand of hair. Kerato is a reference to a very hard, tough tissue. The skin becomes keratinized, that's why it's become so tough and so waterproof. The next one, onycho, is a reference to the nail, either the toenails or the fingernails. It could mean either or. And the last one, seb or sebo, is a reference to oil. Now, your sebaceous glands are glands that produce the oil that makes your hair oily. Alright, now we'll talk about the basic anatomy of the integumentary system. This is something that will cover the entire surface area of the body. And of course, it will be dominated by the largest organ that we have, the skin. So the integumentary system is not just the skin itself. It includes the hair follicles, the nails, all the different kinds of glands, the oil glands or sweat glands, and also the sensory receptors. So all of that collectively is the integumentary system. So it's not just the skin. It's the skin plus everything that goes along with that. Alright, there are multiple layers of the skin. You have the dermis, and just above that you'll have the epidermis, which is the part of the skin that you are able to see with your eyes. And you also have various accessory organs, various sweat glands, various oil-producing glands, various sensory receptors. Alright, that was the basic anatomy of the system. Now we'll talk about some basic physiology. See the primary functions of the integumentary system. Protection, to protect the internal organs. Everything that's inside your body must be protected. See, another primary function of the system is for regulation. This includes everything from regulating how body fluids are lost to regulating how well your body responds to infections. And the third primary function of the system is for sensation. Being able to detect if something is hot or cold, or if it's light pressure or heavy pressure, can help you prevent from becoming injured. If something's too hot, you're going to let go. Here's a basic illustration of the anatomy of the skin. This upper layer here, the layer that we are able to see, would be the epidermis. The dermis, the main layer, we have all the various blood vessels. The third layer, the hypodermis, also called the subcutaneous layer, where you'll find blood vessels and adipose tissue or fat tissue. You also see various strands of hair and various glands that go with them. You have sweat glands here, various muscles here, oil glands here, and also the various sensory receptors here. Here's a cross-section, and also a side view of the tip of a finger and the fingernail and the nail bed. The nail body, part of the nail that you see. The free edge, part that sticks out just over the end of the fingertip. The lunula here, and also the cuticle here, where the skin meets the part of the nail. Alright, next we'll talk about pathophysiology when it comes to the system. The skin will be much more exposed to extremes of the external environment than any other body organ, primarily because it protects the entire covering of your body. So it gets exposed to countless numbers of pathogens trying to get inside you to make you sick. Extremes in temperature, hot or cold. Your skin is the first barrier between the external environment and your internal environment. So it will face a lot of extremes on a day-to-day basis. Now, many types of inherited and acquired diseases will also impact the skin. Now, in many cases, this is the first part of the body to display any kind of sign or symptom of an internal disorder, because there's a disruption of the skin. Now, a loss of skin can have some very severe consequences, and it can even be fatal, such as dehydration or infection or even severe burns. Next we'll talk about some various signs and symptoms of the integumentary system. See the first one, abrasion. This is the technical name for a scratch or scraping away of the skin. See next one, abscess. This is a small pocket of tissue, usually wrapped around in a membrane. But an abscess is something that you definitely don't want because it's a sign of infection. And abscesses will usually be covered in a fluid called pus. Now pus is a very viscous fluid that's made up of bacteria and also a dead type of white blood cells called neutrophils. And the next three terms on this list, suppuration, purulence, and biogenesis, all relate to pus. The first one, suppuration. This is the process of converting a material into pus. Because remember, it is a viscous fluid that is containing dead white blood cells and also bacteria. So the act of converting a material into pus, that is called suppuration. It's a process. See, next one, purulence. This is containing pus. So this is more of an adjective. So you would say an abscess is purulent because it has pus already inside it. And the last one on here, biogenesis, is a process of generating pus. The genesis means the creation of or the formation of, and the prefix pio is reference to pus. So the creation or the formation of pus. The cellulite, this is an area of fat deposits that are found under the skin, usually around the hips and the thighs. And the way that the fat is deposited, it gives the skin a very dimpled appearance. That's called cellulite. Next one, cicatrix. This is the formal name for a scar after a wound is healed. And whenever you have more than one scar, those will be collectively called cicatrices. So you can't just add an S to the end of this word because it ends with X. So cicatrix is one scar. More than one scar would be cicatrices. The next one, comedo. This is another term for an infected hair follicle, which will produce a blackhead pimple. And the last one on here, a pimple, is actually a generic term because there are various types depending on the shape and the size and the consistency. But a pimple is really just a small inflamed area of the skin. And of course usually found on the face, neck, upper back usually, but more commonly on the face. Contusion is the formal term for a bruise. Cyanosis is the condition of appearing blue in color. The root word here is cyan, is a shade of blue. So cyanosis is the condition of being cyanotic or having a bluish appearance, either in the fingertips or in the lips. The next one, cyst. This is a small membrane-bound area, usually on an organ that will be filled either with a solid material or gas or a liquid, but it's something that should not be on that organ. It's an area of infection, but it's filled with any number of types of materials. And last one on here, edema, is a formal name for swelling. Alright, some other signs and symptoms of the system. See the first one on here, erythema. This is a superficial reddening of the skin, usually in patches in a response to an injury or an allergic reaction. The prefix or the root word eryth is always reference to red. So think of red spots all over the skin. That would be erythema. The next one, fissure. This is a slit-like gash that goes through the epidermis and also the dermis. So when your skin is cracking, it's because of a fissure. Yeah, the next one, furuncle. This is another term for a boil, which is a tender dome-shaped infection area right around a hair follicle. And the last one on here, induration. This is a process of a soft tissue becoming more hardened, usually due to an infection or an injury. So as an area of the skin becomes thickened and more tough when it shouldn't be, that overall process is called induration. Alright, on this slide we have some very common skin signs. And all these, even though they are related, obviously, they have individual names because they represent something different in each one. So the first one, a macule, another word for a freckle, is a discolored spot on the skin. The pustule, over here, small, elevated, circumscribed area filled with pus, another term for a whitehead would be a pustule. Wheal, a localized elevation area of the skin, usually accompanied with itching. This is what you would see in hives, for example. The ulcer, or an erosion. The gnawing away or the eating away of a tissue. And for the skin, a good example would be a bed sore, a decubitus ulcer. Papule, a solid, circumscribed area of the skin, just like a pimple, but it's going to be solid. Fissure, we talked about on the last slide, crack-like slit that goes through the top two layers of the skin. very common in athlete's foot. And last one on here, a vesicle is a small sac that's filled with fluid, basically another term for a blister. And when a vesicle gets really large, it's now called a bulla. So a bulla is nothing more than a large vesicle. Now here's an image of what a furuncle would look like, or another term for a boil. Hardened and dome-shaped area around an affected hair follicle. Jaundice. This is a condition of being yellowish in appearance, usually in the mucous membranes such as in the eyes or in the skin in general. And this is due to a failure of the liver to remove a certain pigment from the body. So being able to recognize the sign of the integumentary system is a good indicator that the liver is starting to fail. Because the whites of the eyes should be white. They shouldn't be yellow. Your skin shouldn't look yellowish in color. It should be a normal skin tone. So any changes in the skin's appearance or the skin's coloration is an indicator that something else is going on. The next one on here, a keloid. This is a large elevated area of the skin. Usually after an injury, when the skin will heal, there's an overproduction of skin cells, of collagen fibers. So those fibers form a raised area just beyond the scar tissue itself. Laceration, another term for a cut. And the last one on here, macule. We talked about this earlier on illustration of all the different skin conditions. And macule is just another word for a freckle, a discolored area of the skin. Right, here's an example of what keloids would look like. Numerous elevated scars, all because of the excess production of collagen after those injuries have healed. See the next one, nevus. The nevus is another term for a birthmark. So a birthmark or a mole that is a congenital issue. That's something that you are just born with. Pallor is a very unhealthy, pale appearance to the skin. So when someone becomes ashen, they become very, very pale. So the formal name of that would be pallor. The papule, we talked about this earlier, is another word for a pimple, a solid, elevated, and circumscribed area of the skin. See the next one, petechiae is how that word is pronounced. These are very, very small pinpoint bleeds underneath the skin. You officially have broken blood vessels, but because they are so tiny, they look like little pin drops of blood in an area. And the last one on here, pruritus, is a condition of having a very itchy skin. Here's an example of a nevus, which is a birthmark or a mole. Purpura, this is very related to petechiae. These are indicated by bleeding underneath the skin. But with petechiae, those are very, very small, almost pinpoint size, and those tend to be more reddish in color. Purpura are going to be a little bit larger and will usually appear purple in color. But they both reference the same overall condition, where there's bleeding underneath the skin. Pustule, one we discussed earlier already, is another word for a whitehead, a circumscribed raised area that's filled with pus. See the last one on here, ulcer. This is an open sore that has not healed. This could be either internal or external. You can have an ulcer on the inner lining of your stomach, for example, a peptic ulcer, or in the intestines. And one that's listed here as a reference to the integumentary system is the decubitus ulcer. That's another word for a bed sore. It's usually found on various pressure points of someone who is bedridden or someone who is comatose. Even if someone is in a coma, they still need to be rotated every few hours, because otherwise blood will pool at certain pressure points, like on the hips or in the knees, for example. And that skin will slowly wear away, and you get open sores that just won't heal. They'll keep getting larger and larger and larger. And of course, whenever you have an open sore like this, especially in the skin, you are just inviting more pathogens to come in and cause more infections. The next one, urticaria, is a rash of red welts throughout the body in response to an allergic reaction. It's basically another term for hives, where you have a collection of wheals that are elevated and in response to some type of allergy. Verruca is another word for a plantar wart, which is a very painful wart found on the sole part of your foot. Vesicle and wheal, two we've already talked about in this video already. A vesicle is another term for a blister, a small fluid-filled area. And when they get really big, they're then called a bulla. But it's just another term for a blister. Wheal, raised, elevated area that's usually accompanied with itching, usually extreme itching, such as what you'll find with hives or urticaria. And here's how hives or urticaria would look. And these raised areas here, here, all these raised bumps that are causing the itching, each one of those would be a wheal. So that's one wheal, there's one, and so on. Alright, now we'll talk about some diseases and disorders and the various word parts. First, some prefixes. The first one, EC, or ek, this would mean outside. And the second one on here, par, would mean something not normal or something that's abnormal. Alright, now we'll talk about some combining forms. Actin, or actino, is reference to light. Adeno is reference to a gland. Albin, or albino, is reference to white, such as someone who is albino is someone who lacks any pigment within their skin. Carcin, or carcino, is reference to cancer. So a carcinogen is something that causes cancer. And the last one on here, cellulo, is a reference to connective tissue within the body. Okay, some other combining forms. The first one, chymo. Chymo is reference to pour, or to pour a liquid. Crypto means hidden. Dermo, or dermato, is a reference to the skin. Folliculo is a reference to a follicle, like a hair follicle. Hydro is a reference to sweat or sweating. And kerato is a reference to keratin, which is a very hard, tough substance. Leuco is a reference to white. So a leukocyte is the technical term for a white blood cell. You may see this spelled with a C or with a K. Either way is fine. Leuco is always a reference to white. Melano is a reference to a pigment, usually black pigment. Myco is a reference to fungus. And be careful not to confuse that with myo, it's M-Y-O. That would be a reference to muscle, but myco is a reference to a fungus. Onycho is a reference to a nail, such as a toenail or a fingernail. And last term on this page, pediculo, is a reference to lice or a louse. See the next one, sclero, is a reference to the sclera, which is the white part of the eyeball itself. Trick or tricho is a reference to hair. And the last one, zare or zero, is a reference to being dry or dryness. Alright, now I'll talk about some disease and disorders word parts, talking about some general suffixes. The first one, the ending the letter A. This could mean any number of things, but usually will reference a number of an item. So if it ends in A, it's usually talking about a singular item. If it ends in AE, it's usually a plural. Such as a vertebra would be just one bone of the spinal column. Vertebrae would be two. The suffix IA is a reference to a condition. The suffix IC is a reference to pertaining to. Thoracic is a reference to the thoracic cavity, pertaining to the thoracic cavity. Ism, this is a process or a condition. And last one on here, itis, means inflammation. So appendicitis, inflammation of the appendix. Malacia means softening. So osteomalacia would be softening of the bones. Oma is a reference to cancer. So carcinoma, melanoma, all those are references to some kind of cancer. The next one, osis, is a reference to a condition, usually an abnormal condition. Pathy is a reference to disease. And last one on this image, urea, is a reference to a flow or a discharge. Alright, now we'll talk about some diseases and disorders of the integumentary system. The first one, acne, very common, especially among teenagers, due to infected sebaceous glands on the skin, usually on the face or on the neck, sometimes the upper back. See, the next one, actinitic keratosis. This is a skin condition where you have raised areas of dry, very crusty patches of skin. This is all due to the damage caused by ultraviolet light. Albinism, a condition of having a very white appearance. We'll talk about this term a little bit more in a second. And the last one, alopecia. This is either a partial or a complete lack of hair where hair normally should be growing, such as male pattern baldness. Something that is inherited, something that is passed on from generation to generation, usually from mother to child. And going back to this term here, albinism, we're going to break that term down. The root word albino is a reference to white. And then ism means the condition or a disease. So we add those together, you have a disease or a condition of being white or having a lack of pigment. It's a common image of what acne would look like. The various lesions here on the side of the face, on some of the neck. See the next one, burn. This is an injury to the skin due to a fire or a flame of some kind. There's a wide range of severity of different kinds of burns that you can receive. Some are not that big a deal. Some are very life-threatening, depending on how widespread not only the burn is, but how much of the body does it cover. And the terms that you see here Partial thickness, superficial burn, partial thickness, deep burn, and full thickness burn are more commonly known by first degree, second degree, third degree. So for the first one, a partial thickness or a superficial burn will be a first degree burn. And I think it's easier to remember it that way because a first degree burn only impacts the epidermis layer of the skin. It only impacts one layer, so it's a first degree burn. This would include something very simple, such as grabbing a hot cup of coffee and without realizing it's that hot. So you immediately pull your hand back. That's technically a first degree burn. Now most sunburns are first degree burns. Next kind, a partial thickness, a deep burn, is also called a second degree burn, because you're impacting not only the epidermis, but also the dermis layer also. So you're affecting two different layers of the skin. This kind of burn, you'll have blistering is a very good indicator of a second degree burn. This will obviously be a little more serious than a first degree burn. And the last one on here, a full thickness burn, also known as a third degree burn. These are very, very serious, because these include all of the epidermis, all of the dermis, and even some of the hypodermis layer. At this point, the skin will become charred, like you would see on a piece of meat, like on a steak, for example. And there's usually no pain involved here because the nerve endings have been damaged so the person doesn't feel pain. So these will increase in severity and increase in the amount of danger. A first degree burn, normally not that big a deal. Second degree takes a little bit more care. Third degree can be very, very serious. Here's an illustration that has the information that we just covered, but in a graphic. So a superficial burn, or a partial thickness, only impacts the epidermis. Partial thickness deep burn, a second degree burn, is going to impact all of the epidermis and some of the dermis. For full thickness, you're getting all three layers affected. So you're getting damage all the way down. And there's also a fourth degree burn. It's not listed here, but a fourth degree burn would go all the way down into the bone itself. See, next one, carbuncle. And this is a cluster of red, swollen boils that are all attached to one another underneath the skin. One boil will be a furuncle, but a carbuncle is a cluster of these all together. Alright, the next set of terms is all a reference to different types of skin cancers. And the reason why they have different names is they are affecting different parts of the skin, which means they'll be treated differently, and some are more dangerous than others. See, the first two kind, basal cell and squamous cell carcinoma, these are the vast majority of all skin cancers. They fall into one of these two categories. These two are either they're the more common kinds. They typically do not spread to other parts of the body, so they may cause some disfiguring if they're not caught early enough, but are usually can be dealt with. And these two kinds are also the ones that are going to be much more common in older people. And of these three, the most serious one is melanoma. This is much more common in people who are in their early 20s, for example. And this is a very aggressive type of skin cancer. If melanoma isn't caught early and treated early, this can become very serious very quickly. Here's an image of what a carbuncle looks like, a cluster of boils underneath the skin. An example of basal cell carcinoma. Cellulitis. This is a bacterial infection of the skin. Very, very common. The skin will have a reddish, bumpy appearance to it. An example of that would include folliculitis, which is an inflammation of a hair follicle. The hair follicle itself will become inflamed or infected. Here's an image of cellulitis. The red, swollen areas here. These would usually be tender and very warm to the touch, all due to a bacterial infection. Dermatitis. This is a very generic term that basically covers an inflammation of the skin. See, some examples of that would include contact dermatitis, where you get a skin rash that is due to becoming in contact with a substance. Being exposed to a soap or a fragrance or poison ivy, for example. Your skin was in contact with something that caused it to become inflamed. Another example of dermatitis would be seborrheic dermatitis. And this is a condition where you'll have scaly patches, dry red skin, usually found on parts of the body that tend to be more oily, like on the scalp, the upper chest, the back, for example. Another common example of dermatitis, actinic dermatitis, inflammation of the skin because of exposure to UV light, which can develop into blisters. So the more formal term for a sunburn. The next condition, eczema. We're going to have patches of skin become very dry and very rough, covered with blisters, and may be very, very itchy. Sometimes the even will bleed also. And an example of eczema is something called atopic dermatitis, a condition where you'll have areas of the skin that are very red and very itchy and scaling. It tends to be more common in children, but it can occur in anyone of any age. So eczema is basically anything that will cause your skin to become red and itchy, and an example of that would include atopic dermatitis. An example of how dermatitis would look, basically an inflammation of the skin. See, next condition, ecchymosis. This is the skin becoming discolored due to bleeding just underneath the skin, so usually caused by bruising. So after you get a bruise, the reason why you get the purplish color or the orange color or the yellowish color just around that is due to the bleeding underneath the skin. So next one, herpes. This is a general term really that covers a group of diseases that are caused by a viral infection. Usually will affect the skin due to the blistering that it causes. It can also affect the nervous system. And there are more than one type of herpes, not only on what causes them, but by where they're found. Type 1 is also known as oral herpes. It's where you'll find blisters and cold sores around the mouth. Then herpes simplex number 2 is genital herpes. It's where you'll find the sores around the genital. Here's an example of type 1 herpes with the lesions, the blisters right around the mouth. Here. The next one, hyperhidrosis. This is a condition of excessive sweating. Hyper means an excess of or above normal, and hidrosis, or hydro is reference to sweat. So an excessive amount of sweating, usually in the armpits or in the palms of the hands or the soles of the feet, or even on the face. The impetigo is a bacterial skin infection that is contagious, and it's indicated by sores that tend to be crusty in appearance and also yellow in appearance. Kaposi sarcoma is a rare type of tumor that's often associated with people who have AIDS. And this is a type of cancer that will develop within blood vessels or in the lymph nodes. And the last one on here, leukoderma, is another word for vitiligo. This is where you have a localized loss of pigment in the skin. So basically your skin, instead of being one skin tone throughout your body, there'll be patches of your skin that has become lighter because of the loss of pigment. And going back to the first term here, hyperhidrosis, the prefix hyper means excessive, hydro is reference to sweat, and osis means a condition. Hyperhidrosis, a condition of having excess sweat being produced. Alright, an example of how impetigo would look. The pustules along with the crusty yellow sores. Kaposi sarcoma, the lesions tend to be either red or a purple in color. See the next one, malignant melanoma. Of course, malignant is an indicator of a bad type of cancer, is what you definitely do not want. So it's a skin cancer that involves the melanocytes. The melanocytes are the cells that actually produce your skin pigment of melanin. So how much melanin you have will be indicated by your skin tone. So malignant melanoma is a cancer that affects those melanin producing cells, the melanocytes. And a good indicator of this condition is having a mole that will change shape and change color. The next three are all related to a fingernail or a toenail and various conditions that can affect those. The first one, onychocryptosis. This is where you have the corner or the side of the nail that will start to grow into the flesh, an ingrown nail. Or the root word onyx is reference to nail, crypto is reference to hidden, so the nail is becoming hidden underneath the skin. Onychomalacia. Malacia means the softening, so this is the softening of a fingernail or the softening of a toenail. And last one on here, onychomycosis. This is a reference to a nail fungus. Myco is always a reference to the presence of fungus. Here's some examples of melanoma, and some of the very clear indicating a mole that will change either size or shape or color. So whenever you have a mole with irregular borders, that's usually a red flag. Example of onychomycosis, toenail fungus. Very clear to notice that. That looks much different than any of these other nails. Alright, the next one, paronychia. We'll go ahead and we'll break down that word. Par will mean alongside or abnormal. Onycho will mean the nail. Then ia, the condition of. So this is a condition of having an abnormal either toenail or fingernail. So this is really an infection of the tissue running alongside the nail bed. The next one, pediculosis, is another term for an infection due to lice. Psoriasis is a skin disease that's marked by scaly red, sometimes silver patches throughout the skin. This is caused by these skin cells over dividing, producing more cells than are needed. So those extra skin cells become very thick and silvery and itchy, and they give the appearance of those red patches. And the last one on here, scabies. This is a very itchy skin condition that is contagious, and it's caused by a mite that actually burrows under the skin, and then you'll see a series of raised red spots where it has burrowed in. Here's an example of psoriasis, area of red patchy skin. You see some silvery flakes in there also. Scabies, and a series of the dark red bumps here, will be incredibly itchy and very contagious to anyone who's in close contact with this person. See, scleroderma is actually a group of rare conditions that cause the connective tissue of the body to become very tough and very hardened. And depending on which individual condition you have, it may only impact the skin or it may impact other types of connective tissue, like the bone or like the blood or like the fat. See, next one, SLE, systemic lupus erythematosus. Now, this is an autoimmune disease where your immune system will attack your own body. This could impact anything from the kidneys to the brain to joints, other organs. But this is a chronic inflammatory disease. And one indicator of this condition would be to have a butterfly rash on the face, where you have an area that looks very similar to a butterfly if you were to land, say, on the bridge of your nose, where the outline of the wings would be just above the eyes, over the eyebrows, around the eyes, on the cheeks, and then coming back under the bridge of the nose. So think of a butterfly landing right in the middle of your nose. That's where a rash would appear. That's an indicator of having SLE. But again, this is a group of diseases, so that's not the only indicator. That is one indicator that is possible. See, the next four all fall under the umbrella of a fungal infection. It just depends on what part of the body. So anything that involves the word tinea is a reference to a fungal infection. Now the first one, ringworm, something that's commonly confused. There is no worm involved at all. That's just the name of the condition. It is a fungal infection, and a good indicator of ringworm is the skin appearing in small circular patches, almost like a bullseye or a target logo. See, next one, tinea capitis, is ringworm of the scalp. Tinea pedis is athlete's foot. Pedi is reference to the foot, and tinea corporis is the technical name for ringworm. This is any fungal infection of the body that's not covered in hair. So basically, ringworm of the body. Alright, here's an example of how ringworm would look. The next one, trichomycosis, is a fungal infection of the hair. So if you break the word down, tricho means hair, myco is a reference to fungus, and osis, the condition of. So the condition of having fungus within your hair. And the last one on here, xeroderma. This is having very extremely dry skin. Alright, now we'll talk about some treatments, procedures, and devices, and some word parts. The first one, abrase or brazo, means to rub away. Auto means own or self. And think of the term automatically. You're doing something by yourself. Derm or dermato means the skin. Righted is another word for wrinkle. See some suffixes. Ectomy is the surgical removal of. The suffix ion is a process. Plasty is the surgical repair of. And the suffix tome is an instrument used to cut. Alright, next term, a biopsy. Often you'll see this abbreviated as BX, either lowercase b or capital case B. This is when a sample of living tissue is taken out of a patient and to see if there is a cause of a disease or to detect the presence of a disease. Next term, debridement, is the removing of a foreign object or damaged tissue from a wound. The next term, dermabrasion. This is the process of removal of the superficial layers of the skin with a very rapidly moving tool to help skim away those various layers of the skin. It's something that's very common in cosmetic surgery, for example. And cosmetic surgery, another term for plastic surgery. This is a surgical specialty that will focus on correcting dysfunctional areas of the body. It's used as a reconstructive method, either due to injury or trauma or a birth defect. And the last term on here, chemical peel, is a body treatment that's used to improve the overall texture of the skin. Basically using chemicals to cause the dead skin to slough off. Okay? In this image we have an example of a debridement Really, it's another term for cleaning of a wound. A wound can't heal properly if there's damaged tissue or if there's debris within the wound. See, the next two terms are pretty much interchangeable: dermatoautoplasty and autograft. Dermatoautoplasty is not that commonly used of a term anymore, but it's using your own skin to repair or replace some damaged skin. Dermato is reference to the skin, auto is your own or self, and plasty is the surgical repair of. So using your own healthy skin to replace an area of damaged skin. And this is more commonly called an autograft, because it's basically a skin graft from you, your own skin. The next term, dermatoheteroplasty. Again, dermo means skin, hetero means different, plasty means the surgical repair of. This is receiving a skin graft from a different species, compared to an allograft. An allograft is a sample of tissue that's taken from the same species, but from a different individual. So if you were to donate some of your skin to a child or a sibling or a total stranger, it's a different person, but still the same species. It's still another human being. So different species, dermatoheteroplasty. If it's from the same species but a different person, that'd be an allograft. If it's from you, if it's your own tissue replacing some of your own damaged tissue, that's an autograft. The next term, dermatome. There's more than one definition for this term, but regarding the integumentary system, and for what we're talking about, a dermatome is an instrument that's used to cut the skin to prepare a skin graft. And last term, dermatoplasty, is the surgical repair of the skin, and it's done so by using skin grafts, for example. All right, next term, emollient, is another term for being able to soften or to smooth the skin. The moisturizers or shampoos are often described as being emollient because they will soften skin or soothe the skin. The antibiotics, treatments used to eliminate bacterial infections. The retinoids, these are a class of compounds that have very similar actions to that of vitamin A, and what they primarily focus on is the growth of epithelial cells. And you'll see this come up especially with skincare products like retinols. These are antioxidants that help the skin grow and appear healthier. So you'll see a lot of these in moisturizers or anti-aging products. And the last one, ultraviolet light therapy. This is a course of treatment that involves ultraviolet light, and it's usually used to focus on skin disorders such as vitiligo, for example. It can also treat psoriasis and other atopical skin diseases. And sometimes this is referenced as phototherapy. And the way this works is the frequency of the UV light will interfere with the cell growth and excessive cell growth. So instead of cells dividing more and more, creating these scaly patches like you see in psoriasis, those cells aren't produced, so the patches will go away. Alright, the next three terms on here are all a type of cosmetic surgery or plastic surgery. Procedures that are done to either repair or correct a dysfunctional part of the body, or a part that the patient deems to be dysfunctional. The first one, rhytidectomy, is the surgical removal of wrinkles. So another term for a facelift, which is very closely related to the second term, rhytidoplasty, which is the surgical repair of wrinkles. Now these two terms are synonyms for one another. You are essentially removing wrinkles in both cases. And last term on here, liposuction, suctioning out a lipid or a section of fat material. Taking a closer look at the second term here, rhytidoplasty. Rhytid would be wrinkles, plasty, surgical repair. So a surgical repair of wrinkles. And here's how that would look. So this is basically why it's called a facelift. There's an incision made near the top of the head, near the scalp, and the skin is pulled tighter and then sewn back together. That's how wrinkles are removed. Alright, next we'll talk about some common abbreviations that you'll see with the integumentary system. See the first one, BCC. It stands for basal cell carcinoma, a type of skin cancer. BX stands for biopsy. SLE, systemic lupus erythematosus. The next one, SQCCA. It stands for squamous cell carcinoma. SQ would be the squamous part, cell carcinoma, CA. TBSA, that stands for total body surface area, often used when you're talking about a patient being burned over a certain percentage of their body. I will end our video with our usual combining form quiz. The terms on the left, myco, auto, hydro, tricho, and onycho. They'll match with either nail, sweat, self, hair, or fungus. The first one, myco, goes with fungus. Auto means self or own. Hydro means sweat. Tracho means hair. And onaco, nail. And here are all the correct matches to these terms and their definitions. And that brings us to the end of our video on chapter number 5. We will continue our video series on medical terminology with our next video covering chapter number 6.